Welcome everyone to Healing Mindset, the space where curiosity meets expertise and insight becomes transformation. I am Nazish, your host, and I'm thrilled you're joining us today. If you have ever wondered how dentistry goes beyond teeth to truly impact someone's confidence and well being, today's episode is for you. We are joined by Dr. Edward Feinberg, a pioneer in restorative dentistry with over 4 decades of practice and a legacy built on 70 years of evidence based innovation. As the director of the Onward program, Dr. Feinberg is reshaping what excellence in crown, bridge, and implant work looks like, not just procedures, but as pathways of restoring confidence, trust, and quality of life. Welcome to the show, Dr. Edward.
Thank you.
Okay.
It's great to be here.
Yeah, you're very welcome. So, Dr. Feinberg, dentistry blends art and science in such a unique way. For those who are listening right now and may not fully understand this, what first inspired you to focus on restorative work, especially crowns and bridges?
Well, I grew up in it. My dad was a master and pioneer of full mouth reconstruction and crown and bridge dentistry. And
Yep.
the techniques that I'm doing came from him and from his teacher. So between my dad and I, we have 70 years of documented evidence for the basic principles that we teach. And unfortunately, my area of dentistry has gone away from these basic principles. So a lot of my colleagues are having difficulties with problems that were actually solved in the 1930s.
Okay. Okay. That's incredible. And it truly shows that dentistry can touch lives far beyond what we see on the surface. And was there a particular patient or a moment that made you realize that how much restoring a smile can transform someone's confidence and or outlook towards life?
Yes. I grew up in it, so I was familiar with it. I saw my dad do absolute miracles on patients. I had been working in that office since I was 16 years old, and I saw many transformations that were amazing. And in fact, when I started doing these cases as well, I got teased by the office manager for causing all these divorces because all of the patients, their appearance and function and everything and their feeling about themselves changed dramatically. And they would ask themselves, why am I with this guy? I don't need him. So I was accused of creating all these divorces.
That is such a fun experience you have had. I mean, making people look better and then they realizing their self-worth. What is better than that?
Yes. Well, actually, my focus is really mostly on health and longevity, that whatever you're going to do for a patient holds up in health over the long term. And I see that the focus today is on economics and workflow. And I'm against that. I think that's not fair. And I see things being done that violate basic principles of science and engineering. And while they may look pretty, I think they're going to be disastrous for a lot of people in the long run.
Yeah, okay. That is amazing. You have carried a 70-year tradition of clinical excellence. For our listeners who might be curious about long standing practices, what's the principle that continues to guide your approach today?
Well, for the approach that I teach on my teaching website that I got from my dad and that he got from his dad is a step by step approach because there's so many things that can go wrong along the way, especially if you're heating materials up close to their melting points. And if you identify an error and correct it before you go on to the next step, you're going to have a perfect result. And my dad always used to say that one of the hardest things in dentistry is to be your own worst critic and look at your work critically and not pass anything along. Oh, that's the best I could do, or we'll have to see what happens. These are cop outs. bacteria or microns, you will not get away with it. And so you have to develop that mindset that you are not going to let anything slip past you as far as you're going to do the best of your ability to the best quality that you know how. And the patient is counting on you to do that because they have no idea what you're doing.
I love that. The way you said that you have to be your own best critic. It is such a testament of value of honing what works while staying open to growth.
Yes, and
Beautiful.
I see a lot of closed-mindedness. I'm an outsider in that I'm not affiliated with any dental school or corporation. So people look at me and think, well, like, what does he know? He's an outsider. And I was trained completely differently, and what I'm doing really comes from the roots of the profession, and most people have no idea that what they're doing did not come from the roots of the profession, and I really believe that if we're going to advance scientifically, anything new that comes down the pike must be compared to the standard that came before, otherwise we are not advancing. And how you evaluate new technology should be along the same lines. It's basic principles that matter. Technology is a tool, not an end in itself. And a lot of patients are very impressed with technology, and some of it's very, very cool, but a lot of it's very, very bad. And I'll give you an example of that.
Yeah.
There's a machine that can mill a crown out of a block of ceramic.
Yeah.
That is the end product of that, which comes out of a computer. It's very cool. No one says no. Is exactly the same thing as the old high fusing porcelain crowns that were baked in an oven in the 1930s, 60s, rather. You think we didn't know what was wrong with those things? Those things are what you call, are known as butt joint restorations because ceramic material you cannot make in thin sections, otherwise it'll break. So typically, when you prepare a tooth for a crown, you put a ledge on it that goes all the way around the whole tooth. And then you make the crown to the ledge in a butt joint crown. A butt joint crown will go to the ledge. Those crowns can never be sealed because bacteria are between 2 to 10 microns in size. And the best opening that we could achieve is 120 microns. And it's unrealistic to think that the bonding material is going to seal everything up. That is not realistic. And so a lot of those are prone to decay and crowns falling out. That is the two major problems that dentists are having difficulty with these days. And the proof of it is that they want to extract all the teeth and put implants in. And they're teeth that most of them are teeth that I could save because I've been trained differently. So what I do differently is I make my crowns on the model of the mason jar cover, which is the best known thing ever devised for preserving. That's what came from dentistry's roots. That's why my dad and I and my dad's teacher never had these problems. That's the reason why. And most practitioners do not understand that. They do not know that. So they get frustrated, and rightly so, because this is what they were taught. And they would rather do implants, which they have more confidence in. But that is not really what's best for most patients. A lot of times they look at crown and bridge as nothing more than tooth covering, when in reality, it's preventative. Because if you can compensate for all the things that are wrong, including periodontal bone loss, and change the architecture to preserve health, that's the end of the patient's problem. So, for example, like when you go to the lectures in dentistry or look at the articles in the magazines, you don't see them putting a single tooth implant in among um, virginal teeth. What I mean by that is teeth with no fillings, teeth with no periodontal bone loss. You see quite the opposite. The teeth already have big fillings and are going to need crowns, or they have crowns, or they have periodontal bone loss. Crown and bridge is a much better approach because you can compensate for all the things that are wrong in the whole area. You can bring the forces up close to the bone. And when my cases are x-rayed, it looks like the margins are sitting right on the bone. And nobody could tell that patient ever had periodontal bone loss. And very often that's the end of it. And because they seal the teeth with the mason jar cover concept, really rarely get any decay, except if many years there's been changes and roots are exposed. Those areas can become susceptible to decay. But that's many years later.
Yeah.
So, they don't understand this. And then the other ability I have is that I can tie teeth together so that they help each other out rather than each tooth having to carry the force by itself. And then that prevents food impaction, which is notoriously known to cause periodontal bone loss. So actually, you're able to do something good for the entire area, whereas a single to single tooth implant does nothing for the teeth around it, and the patient's problems are never solved.
That is amazing. Like the way you are telling about how important it is to save the natural tooth rather than always replacing it. And trust me, from what you have told, I completely understand how important it is to save the natural teeth rather than just putting implants. And I
Yeah,
hope many of our listeners are going to benefit from this knowledge.
we started to do implants in the early 80s when they first came to this country. So I have seen everything with implants. I know they are not lifetime. I know they are not panacea. And you can always do them. I would say I would think I could to save the teeth first. And most people don't know that miracles can be done with crown and bridge. In my dad's day, before implants came to this country, he broke his neck to save teeth. And many of those cases worked and they were miracles. And they worked on patients with systemic conditions like heart disease, diabetes, and cancer, where you wouldn't expect anything to work. And they held up 30 years in the mouth on the worst teeth you ever saw with everything against you, and it worked. And a lot of people just say, give up, and they say that it's not possible. So I've done a lot of things that most people think are impossible.
Amazing. So you mentioned recently about this recent technologies and everything. Tell me something. How do you strike balance between time-tested techniques and modern innovations like AI or digital dentistry?
Well, I don't think all of digital dentistry is bad. I look at everything through the lens of basic principle. And that's what my determining factor is. If technology comes along that conforms to the basic principles I believe in, that is good technology. There is good technology. So I'm not one of those people that says, "Oh, this is the way we've always done it, so it has to be done this way." I don't believe that. But I do believe that basic principles have to be followed, and that I see them being violated on a massive basis, where I believe that most practitioners don't even know what the basic principles are. That
Yeah.
is frightening.
That is actually frightening. And this blend of tradition and innovation is fascinating. I mean, it keeps the field alive, dynamic, and ever evolving.
Like one great piece of technology is milling. Scanning and milling is accurate. One of the problems, though, with scanning is that they haven't come up with a method of scanning the entire root surface above the bone and below the gum.
Yeah.
That is the limitation of digital dentistry for crown and bridge. But
Yeah.
scanning and milling has proven to be very accurate, and I have made some milled crowns, and there you get around it gets around a lot of the problems with casting. So there's something there that's an improvement. But again, everything has to follow basic principles. Otherwise, it's not good technology. And I think you can make like porcelain to metal restorations. I think you can make the metal thinner with milling than you can with casting. I think that it could be a very excellent innovation, but it can't replace casting completely. There are still some things that milling cannot do that casting can do. So everything has a place. However, I understand that there's a company in Israel that did invent such a scanner. And if that's true, I heard they didn't release it to the market yet, but they invented it. And if that's true, that would be a huge game changer. Because right now I take impressions in order to get an impression of the entire root surface below the gum. you need to use some kind of band, like a copper band or an aluminum band, in order to do that. And a lot of people think, oh, that's too hard or that's too old fashioned. That's how they think. And there is no other way to do that. And the techniques that are taught, they don't get the impression far enough down under the gum. That is why they're having all these troubles. And
Ex-
I suspect that a professor came along and said, "Oh, we want to teach techniques that we think will be easier." So they came up with the cord technique, which tries to push the gingiva away so you can get the impression material down under the gum. And it doesn't really
Interesting.
work.
Yeah, that is amazing. So, I have known many people who feel nervous about dental work. From your experience, how much of that fear comes from misunderstanding what restorative dentistry truly accomplishes?
I think some people have been traumatized. I said one of the worst things that any dentist could do to a patient is work on them when they feel pain. Even if they say it's okay, it is not okay.
That is amazing. So, tell me something. How do you help patients who view these treatment as a form of healing rather than simply fixing teeth?
Well, I look at things from an overall point of view. What can you do to a patient to prevent them from losing their teeth? And I analyze everything. A lot of times the teeth have a bad architecture, which does not promote health, or they take forces in abnormal directions, which are going to cause damage when the body can no longer tolerate those forces. So I analyze what would have to be done to correct the problem so that the patient doesn't lose their teeth. That is my overriding concern because in dentistry, the whole ball game that determines whether or not you're going to hold on to your teeth is the bone and the roots. That is sort of like a foundation would be for a house. If you were going to build a good house, you would have to have a good foundation in the ground to build a house. Well, in the mouth, the foundation is the bone and the roots. And the way most people get into trouble with losing their teeth is when something happens to the bone. That's what periodontal disease is. We don't know how to grow it back. So everything that we do, everything is geared toward preventing the bone from being lost. So one of the things that we know causes bone loss is letting tartar and plaque and calculus build up because that can cause the gums to become inflamed and that can spread to the underlying bone. So, the single best thing anyone could do for their oral health is to have regular hygiene visits with their dentist and also good home care at home. That is the single best thing. Another way people get into trouble is with missing teeth, because
Yeah.
what happens over time is the teeth around the spaces shift, and the teeth opposite the spaces tend to erupt into the space. And then the teeth start to take forces in abnormal directions, and the whole side and the whole arch collapses. And when the body cannot tolerate this, one of two things happen. Either the bone goes or the teeth wear. And so the purpose of dentistry is to prevent that from happening. And that's why it's so important to replace missing teeth before damage occurs. And it doesn't always happen for everybody because there are some people who have missing teeth and they get away with it. But when you start to see problems and troubles, you should step in. Otherwise, it's going to continue. And that's what a lot of practitioners fail to really grasp, that once bone loss has occurred, there's no telling when that's going to stop unless you do something to correct the cause of the bone loss in the first place. And there are a very small percentage of cases where bone loss happens for reasons that we don't understand, but they're in the very small minority. And if you correct all the problems that are contributing to bone loss, very often these cases stand up against systemic conditions like diabetes, cancer, and heart disease, which you would never expect. You would feel you have everything against you and that this couldn't possibly work, and yet it does. And I can show these cases. And that's what a lot of practitioners don't really understand when they look at crown and bridge as nothing more than tooth covering. And that's not the purpose. The purpose is to correct all the things wrong. What can you do to make things better, even with a single crown? Change the architecture, make the teeth smaller to put less stress on the bone and the roots. These are things that I think about. Everything that I do, it's all straight engineering principles.
Yeah, that is amazing and that is very insightful. And I believe that proper knowledge and proper teaching about these things can help a lot of young training dentists and a lot of people to take a proper step towards the restorative care. Also, as I'm aware, your Onward program trained dentists to raise the bar on restorative care. For our listeners who might be curious about dental education, or who might want to explore dental education further, what gaps in modern training do you aim to fill with this program?
Well, they are not training dentists to do crown and bridge properly. None of the institutions, not one in this country, and that includes every single dental school and the two major institutes of continuing education. There's one here in Arizona and there's one in Florida. Neither of them teach techniques that have a real track record. I have 70 years of pictures and documented evidence for the basic principles that I teach. So my courses are filled with all these case examples because it's not materials or technology that makes dentistry. It's basic principles that make dentistry. And that's what I really teach. And so my teaching website is www.theonwardprogram.com. And I have maybe like 35 courses in crown and bridge dentistry, and anyone can go there. You don't have to be a dentist. The introductory courses are all are free, and the rest of the courses are inexpensive. And if there's a student or somebody who can't afford the to see the courses and they really want to see it, I would give them a code and they could have them all for nothing. Because all I really care about is that they learn how to do things properly and do better dentistry for people. That is, I have no other agenda. And I can't just stand by silently while I see all this going on and see all my colleagues having so much difficulty. And it's very sad to watch when you start to realize that all the problems that they're having were solved in the 1930s. And that is really, that shouldn't be in a learned profession. And so I'm against, a lot of what I see happening. I'll mention one other thing that really bothers me a lot that I'm seeing. And as I mentioned earlier, what the overriding factors now are not health and longevity for the patient, but economics and workflow for the practitioner. This is wrong. And one of the worst things I have ever seen is the thing called all on four, where they pull all the teeth out and they put these four fixtures in, two in the front, or implant fixtures, two in the front and two in the back. And then they build this big superstructure, which not only replaces the missing teeth, but the missing gum and the missing bone as well. And you can't even clean under it. Who on earth would say this is a good idea from a hygiene standpoint? And then what these big superstructures are overloading these four little fixtures, which most of the time cannot be put in the bone deep enough to really support this thing. So I think there's going to be a huge failure rate with these cases. And there are better ways of doing things. And one of the most famous practitioners and researchers of implants, Dr. Carl Misch, said that the treatment of implants must be centered around the biomechanical management of stress. That's what I'm doing with crown and bridge on natural teeth, trying to minimize the forces that are applied to the bone and the roots. And the same thing has to be especially true of implant fixtures, because natural teeth have give to it, because the periodontal ligament that connects the bone to the roots is sort of like, the suspension in a car, and there's some give there. But an implant is like sticking a nail in concrete, and there is no give there whatsoever. What's going to give? The bone is going to give. And once bone loss starts, that just continues until the fixture is lost. So a lot of these all on four cases, if one of those implants goes, that patient is screwed. And because the bone is flattened, they may not be able to have any more implants, and they won't even be able to wear a denture. And no one is thinking about what could happen to this poor patient down the road. And I think this is awful. And I don't think it's fair. And the patients think, oh, well, my troubles are all solved and I never have to worry again. That is so not true.
That is amazing. And talking to you, I really appreciate the fact that the importance of mentorship and guidance in any profession is, and the correct guidance to be precise, is very important for all our young. Yeah. So, for
A lot
all our
of
young,
think they know everything because they can place implants, but they know nothing.
yeah. So, for our young dentist striving to blend with precision, with purpose, so what advice do you have for them for their careers?
Well, your education really begins the day you graduate. And you can't really fault the schools for teaching techniques that, let's say, I don't agree with. What I do fault them for is making the students think that's the only way to do things and that's the best way to do things. That is not true. And it's up to you to try to do things better. And there are better techniques. There are new techniques that come along. You can't just say, well, I learned everything I need to know in dental school. That is just not true at all. In fact, I don't think there's anything that I'm doing that I learned in dental school. Everything I learned was after dental school. And so I think that's very, very important consideration. I think they should also be open minded to other perspectives because my approach to crown and bridge and restorative dentistry is completely different from what's being taught. I can do things that they think are impossible. I have options for treatment that they don't know anything about. And I have options for treatment for people who aren't candidates for sophisticated dentistry, as well as for people who are candidates for sophisticated dentistry. So I think, it's very important to understand that people are individuals and there is no one size fits all. And because they only know how to do implants with fixed bridge work, everyone gets that. And very often that's disastrous because that is the wrong treatment plan.
Yeah, this is so grounding and inspiring. So, just personally, I just want to ask you something. What keeps your passion alive after so many years in practice?
Well, I love what I'm doing. I feel that this was given to me, and it's my duty and obligation to pass it on to others. And that's why I'm doing all these podcasts. I've written I'm writing my third book, which is my second textbook. And
Sounds amazing.
I've been working on that, and I revamped all of the Crown and Bridge courses because I made them a couple years ago, and there's some new developments. I'm better at making these courses, and I updated all of them. So I just finished the Crown and Bridge course and updating that. And at the same time, I've been writing the chapter for the textbook. So I'm writing a textbook on Crown and Bridge and how to do Crown and Bridge properly. It's not just a collection of techniques, but the rationale for why you're doing what you're doing. That's very, very important that everything that you do has a purpose and a reason why you're doing what you're doing. And that's what I have to offer so that you're in the driver's seat. Whatever goes wrong, you've been there before. It's nothing you've never seen. You can handle it. You let it roll off your back. So many people get so nervous, when they do Crown and Bridge because they don't know what result they're going to get. And a lot of it is from skipping steps and not having an idea of why they're doing what they're doing. But once you have a definite step-by-step approach and you understand when something goes wrong that you can correct it and before you go on to the next step, then it becomes fun. And the best feeling in the world, and this is why I'm a dentist, is when you have your patient coming year after year over decades, and you get to watch the work that you did last in health year after year after year after year. You did something great for that patient. And you could say, here, Mrs. Jones, I want to show you something. And you show them their x rays. You see the bone loss that you had 30 years ago before we started this treatment. these are your recent x-rays. Nobody could ever tell that you ever had bone loss. So we were able to that completely, and they get to hold on to their teeth. That is the best feeling in the world. Nobody, they know you're special, and they're going to send you their friends and relatives. And
Amazing.
they know that they have friends and relatives who are having a lot of difficulties, and they are not. And that's the best feeling in the world.
That is beautiful. A great reminder for everyone listening that mastery is a journey, not a destination. So before we wrap up, yeah, before we wrap up, Dr. Feinberg, how can our listeners learn more about your work and connect with the Onward program?
Well, anyone can go to www.theonwardprogram.com. I have a lot of information on there. I have a lot of podcasts that I've done, like this one, on my website. And I have a documents library with a lot of information. I write a monthly blog on different issues about dentistry. Anyone could read that. And if they want to be on the mailing list and they visit the website and put their email address in, then they will be on the mailing list and be notified when the blogs are coming out of any changes that are happening in the field that I think are important, that kind of thing. So you don't have to be a dentist in order to take advantage of that. Just be interested in dentistry.
Perfect. We'll make sure to include all these details. And so any of the listeners who is inspired by your work can dive deeper. Dr. Feinberg's journey shows us that healing isn't about the mind or body. Sometimes it begins with a smile. His dedication to precision, compassion, and education reminds us that restorative dentistry can restore far more than teeth. It can restore confidence, trust, and quality of life. To learn more, visit theonwardprogram.com. And thank you for joining me on the Healing Mindset. I am Nazish, encouraging you to notice the power of skill, heart, and intention in every act and to carry that awareness into your own life. Thank you so much, Dr. Edward, for your time and efforts.
Thank you very much. I always value any opportunity I get to spread my message. I think it's an important message, and I want patients to understand that they should question things, and they should, not just take everything at face value because so and so said so, and that we're all different. We have different levels of knowledge too.
That was amazing. So it was an honor hearing about your decades of dedication and your approach to restorative care. I know our listeners are going to be way more inspired to combine science, artistry, and compassion together.